So he has the hurt. Yeah, you have. So you're actually, this is extending all the way, and I'll show you. Like, look at that. See that? That's going all the way over there, right there. See that fluid? So I have to, and so unfortunate. When did this wound start? Oh, barely. Why don't you call us? You didn't know that, but you knew you had a wound, right? Hmm. Even a little bit. So you know, even a little bit, you're supposed to call us immediately, right? See. Mm-hmm. I already saw it from the top. I thought, ah, shoot, this is about to be crazy. So, I always tell you, it, anything that is abnormal, and abnormal meaning it wasn't there yesterday, call us immediately because this started off with this little wound here, and it was, well, there was a callus, and I kept saying, we need to offload this callus. That callus wore in, and look, there's a hole straight to the bone. Right there, I can feel your bone. So now, let's pause it. You see how here's swollen? There's also an abscess here. Look, there's fluid. So this from the bottom has gone to this joint. And if it goes to this joint, then it just kind of goes and then, oops, so see this fluid here. Look at that. And his swollen. Oh, that fluid is coming from the joint because this from the bottom. So see if I push up here. And I may actually have to send you to the hospital for some IV antibiotics. IV into through your veins, not oral, because you haven't had the best blood flow, and then you have this one here too, which is also threatening because this can form a wound, which we don't want. But the most important thing now, the most concerning thing is you have this wound. This comes to the bottom. All right. You have this wound that extends. I'll use this here all the way inside. Like, so we see this? Look how much it goes in. And I can feel your bone. So this is a deep wound. So I will send you into the hospital and try to clean this out. I know it's about 1.1. Here saying, okay, it's going here, such, but then look at tunnel all the way here. We're all the way there. And
I ain't feel none of that.
that's because you're diabetic. Look at that. So if I had to see how much is going in, look at that. That's crazy. All right.